Hello, I'm Jonathan from the YMCA, and I'm very fortunate to have this opportunity to bring you a Be Well series on the youth mental health crisis. And this is a very poignant topic for our community. In the last couple of days, I've had more recent conversations with principals in the area, and just hearing the impact in the schools, all the acting out, so to speak, of our youth in grappling with the time that they're coming through in the pandemic. So I'm really looking forward to our guest today and what he's going to have to say, offering us insight as well as guidance in moving forward. So I'd like to introduce, we have Dr. Kelsey Bradshaw, a licensed clinical psychologist. He's also the training supervisor at Sharp Mesa Vista Child and Adolescent Inpatient Unit. He works as part of an interdisciplinary team serving youth with acute mental health needs. So we're very fortunate to be able to bring expertise to bear to the topic. Dr. Bradshaw, welcome.
Thank you for having me, Jonathan.
So the youth mental health crisis, if you kind of give us maybe some backstory to where we are today. The Surgeon General made this pronouncement recently. So if you will, just give us some context.
Certainly, yeah. So as you brought up, the Surgeon General put out a report, which you can find online and is actually a very useful document. And it's kind of timely in the sense of recognizing all the stressors that are going on within our society and within the country. And essentially talks about how there is an increasing need for mental health supports for our youth. And citing some various data points that have shown how there's increasing depression and increasing kind of suicidal thoughts and actions that have been going on in the youth. And that this kind of data or potential trend was going on prior to the pandemic, but just kind of how there's additional concern in the midst of the pandemic because of how that is just affecting, kind of all of us.
And how have we met this or not? I know some of the literature I've seen or research notes that there aren't as many therapists, practitioners, programs to be able to respond to this need.
Mm-hmm. Yeah, and I think that is a bit of a sad reality, is that there is such a high need. And I know even, for example, the need for, psychiatrists that work with children and adolescents has always been something that's been hard to come by. There are more and more nurse practitioners that are getting into the field to help offset that need. There's still a lot of training going on in terms of master's level clinicians and doctoral level clinicians, but right now, I think we can, see that need, and I hear it in talking with parents and in getting, calls myself of just there's such an increased need right now. One thing that I think has maybe tried to help offset that is through providing virtual-based services, which do kind of allow to kind of go beyond your more maybe initial neighborhood. But also that varies in terms of, what the need is for the youth and kind of their responsiveness to virtual therapy. For some, it works out great. For others, it's not always the best option. And I know there's been a lot more emphasis on trying to recruit or even offer web-based or other virtual-based services. And even kind of seeing a lot of celebrity and sport athlete endorsement of these kind of services and platforms that are kind of going on. So hopefully that is helping to offset some of the need, but I don't know enough on kind of what that data looks like in terms of, how often that's being used or how people are finding that beneficial.
Yeah, I was curious to that point. It's been an emerging trend, and I just wonder about the efficacy, the impact, and obviously we'll have to do more research longitudinally. But I like the idea that, as you noted, it provides access to many readily, and so I greatly appreciate that. Kelsey, you shared that this trend in terms of increase in depression, suicide ideation has been rising, and the pandemic may have escalated some of that because of those stressors. pre-pandemic, what was bringing this about for our youth?
I don't think there's a consensus on that, but some researchers have pointed at various things. And so I think there's probably a combination of different things. One is I think it's becoming a little less taboo to be able to talk about mental health concerns. And so I think even if we think about generational changes, I think we're having some upcoming generations that are helping to try to destigmatize mental health and are just much more open about those things. Whereas I think historically, and if we look at the research, there's been a tendency to just kind of, for people to sometimes suffer in silence. So I think there's probably a role there. I think there are certainly other aspects and some mixed results around the idea of technology and just social media aspects. So in some ways, that also provides more awareness into what's going on. It provides platforms for people to share and talk about what's going on and even to connect. And in some ways, it might be a bit of a double-edged sword. So there's a lot of opportunity, both in terms of accessing resources and not feeling so isolated or alone. And then the other side of that sometimes can be potential over-identification with mental illness, how individuals can respond to what's in the online world. So whether that's glorifying maladaptive coping, or if that's like I said, getting overly connected to an identity for mental health, or even in cases that I think we're already aware of, like virtual or cyber-based bullying, comparison effects. Those are some of the things that we have to be more concerned about. But I think those are two kind of areas that would probably help us to try to better understand this shift.
Yeah, interesting notes that you made there in terms of social media and whatnot. I was talking to a principal yesterday, and he was acknowledging some of the acting out at his school and just the vandalism, the graffiti, the acting out on a number of different levels. And he was making note of how the phone and just the social media of being on the phone and having to get likes, and if you don't get a like, just the impact of that, especially for our younger ones, that it's that stage of development where they look to their peers and they look how to differentiate. It's that development of their own identity, and so often it's an external look in contrast to see how they measure up. And I just wonder how the incidence of that is compounded during this particular period of time that technology has come online, even greater in this generation than previous.
Yeah, I think that's something worth kind of being aware of, and is being examined kind of as kind of we're noticing those shifts. You brought up a good point, Jonathan, about how developmental periods and thinking how peers become such a notable influence, and that there is this tendency to, for all of us to want to be noticed, to feel like something, to feel connected. And so in some situations, individuals might kind of gravitate towards these things that could be problematic, that may unfortunately be almost like normalized in kind of this online world. I think kind of similarly, you're reminding me of some stuff that was going on in the media not too long ago about various challenges to do destructive damage, and that they were kind of seeing that was a bit of a trend through some of the social media platforms, and so that could be a factor. Hard to say kind of how frequently that's occurring, but also in the context of a pandemic where there is increasing stress and challenges and strife, how that might kind of really lead to this kind of challenge where there becomes more acting out, because we do know that oftentimes these acting out behaviors oftentimes are kind of due to what is going on internally for that youth. And so if things aren't going well at home or in their own social life, then we are going to see some of that acting out behavior that, in some cases might be normalized by what they see online.
Yeah, excellent point. I'm just looking at this time that we're coming through currently, and the last 2 years of the two last school years, and going from distant learning to now coming back into in-person, and a great push by families and the schools to have in-person, because it sounded like we lost some oversight during that 1 year with the distant learning, because often that school is that touch point where a teacher recognizes someone who's more withdrawn or acting out, and then a school counselor can get involved, and or a pediatrician gets involved, and with having to isolate and what the pandemic brought about, there wasn't kind of the community in some ways looking out for our youth. And so I wonder, what your thoughts are about this now that we're at this period of time.
Yeah, I think that's a good observation, Jonathan, and it reminds me of some things that were noted in the Surgeon General's report around how, getting back into routine doctor's visits and having more support to the school staff and awareness, because you're right, those are touch points, right? We know that having our youth more connected with other supportive adults is going to be a safety factor. And so in the midst of trying to kind of maintain safety through the pandemic, one of the inadvertent kind of consequences is maybe having less of that structure or oversight. And I think we'll probably continue to see maybe some research as that is probably being collected now about kind of what exactly that entailed. But I do recall, for example, even just kind of the number of calls to CPS had gone down, right? And so there's just a lot less awareness. So going forward, I think it is important that we continue to try to be aware of these things and try to, as we can in a safe way, take advantage of having those supports and contacts. And one of the things I'm kind of thinking as we're kind of talking about this as well, that we also need to be aware of is, we're talking about youth mental wellness, which is important. And yet we as the adults are the ones that are looked on to be a support. And oftentimes there are many adults who are not doing well, and that we also need to be prioritizing our own self-care, because, for example, if we think about the schools, I think there is a lot of burnout that's going on within the school systems because of different things that have been going on or how things have been reacted to. And we need to kind of support everyone globally, because that's what's going to help us to then support those youth.
Phenomenal highlight there, Dr. Bradshaw. I'm aware of the healthcare industry, the education, all the different critical support services, and just the impact of coming through the time that we've come through, and just the stressors with that. And again, a conversation that I had a couple times this week with school staff in terms of people choosing to retire early, nurses that may not want to come back, just because of how difficult this time has been. And I recognize that all of us, to some degree, our resources aren't as great as we have come through this. And so with that, I think about, you talk about self-care. And so the modeling that goes on, we're all kind of doing the best we can right now. But in a household, the stressors that are involved with parents, kind of the challenges of employment and everything costing more, and health issues, how critical that self-care is, and the awareness of being that role model of well-being. And then, as a parent, being able to care for your child and look out for your child. And so I think, Dr. Bradshaw, if you could take me from the continuum, you're working inpatient, and so some of the most critical cases, and then you help families in terms of them coming back home. So if someone, just tell me your work, what are you trying to accomplish inpatient, and then what in bringing them back into their home, into their environment? What are your objectives, and really, how do you go about it?
Yeah, that's a great question. And again, we are starting with the most acute concerns. And so when things have certainly got to a point where there is a notable safety concern for that child. And so in my line of work, we are really tasked with, one, providing a safe environment to promote safety, but emphasizing stabilization. We see that people in youth get to this point where things become very overwhelming, and so we want to be able to provide an environment where someone can kind of get through that difficult time, get through that crisis, that emotional intensity, so that we can continue to support them. And so in my kind of role and in working with an interdisciplinary team, we are trying to kind of take stock of what's going on with that youth. We're trying to promote some basic coping skills and kind of provide that opportunity for them to stabilize. In many cases, there might be some sort of medication that might help with that. And so looking at medication options and monitoring those things. Part of one of the benefits of a setting like this too is it provides the youth an opportunity to connect with peers. So we do a lot of, primarily group therapy. And so you're seeing that you're not alone. You're seeing other youth who are, maybe having similar experiences or having similar mental health concerns, and trying to give them the tools to how to manage a crisis. And so that's kind of the main thing. From that point too, it becomes an opportunity, like, your term touch point, where, okay, now that we've kind of identified this, let's kind of move them on in that continuum of care. And so we kind of talk about this idea of having them step down to that lower level of care. And so depending on the intensity, depending on, again, what sort of needs or supports they do have, could vary in terms of, intensive outpatient programs, partial hospital programs, respite care. Some youth might need longer term, more intensive services through residential treatment, and then just making sure that they are connected with an outside therapist or med management provider, so that we can continue to address these things, because we know sometimes there is more that needs to be done in a longer term fashion.
Excellent. And so as a family coming to you, what is your work in terms of working with the parents, the caregivers, in terms of what should they be looking out for so that they don't fall back into needing that acute care? How do you support them, kind of that longitudinal in terms of well-being?
Yeah, so in our setting, again, it's very much a team-based approach, and we kind of are tasked with various things to kind of support that child and family. I think we are wanting to highlight those safety concerns, and we talk about safety planning and means restriction, right? Which is something that is also talked about in that Surgeon General report, in terms of just making sure that if we do have concerns for a youth, we're trying to make sure we're aware and creating a safe environment, even in terms of something that delays the potential for an impulsive response in the midst of a crisis. And so we talk about how to try to make the home as safe as possible. We have the youth work on developing what we call a recovery action plan, or crisis plan, which is, taking stock of what are those stressors, what are your current coping tools, what are signs when things are getting bad, and really trying to promote that awareness with their family, so that their family, in addition to maybe learning more as this crisis has emerged, can also continue to expand their awareness of things that they can kind of be on the lookout for, or how to support their child in maintaining their safety. And our social work team does a great job of trying to look at what are the resources, and then kind of talking as a team, what are the kind of discharge options, what does the follow-up care look like, and trying to get that set up, and give certain referrals in terms of different supports, and just being kind of there to be able to hear parents out and to kind of try to support them.
Wonderful. How or what would you say are those next steps to taking them from that stabilization to truly fostering resiliency and well-being in moving forward in their life?
Yeah, so I think I would go back to what we were talking about a moment ago around self-care, and really trying to prioritize and empathize or emphasize that. I oftentimes like to use the analogy of, if you've ever flown anywhere and a flight attendant talks about oxygen masks coming down, right? Like as a caregiver, you have to put on that oxygen mask first. We have to be aware of what's going on for ourselves. And that does promote modeling, but also promotes that opportunity to continue to provide support, because there is such a need. There's a lot that kind of gets put on us in a sense of being that support system. So I think that's one piece. The other piece is just trying to have some compassion, awareness, and patience. We really try to promote effective communication and listening skills, to start to look at, how can we continue to check in with our child? What can we be on the lookout for? How do we promote their ability to use the tools that they're learning? And to just kind of empathize with what's going on for them. Oftentimes, I think as parents, we might feel that sense that we have to resolve, or we have to fix things. There's a real kind of pull for that as a parent. And I think we have to kind of be aware of that and recognize and shift towards, being available and being there to kind of hear and support. And that doesn't necessarily mean we always have a solution for what's going on, or that we jump into problem solving mode.
Great. I remember when you and I had an earlier conversation, we were talking about, some of the family households, the caregivers are tasked pretty heavily. And so to look at what other role models are in that child's life. Mm-hmm. So if you could speak to that a little bit.
Yeah, I think, we're really trying to explore who else is in that family system, who are the other important adults. The school system is another area of support, and I think hopefully we'll continue to see some resources that are put into schools in the midst of trying to support mental health. And so, encouraging parents to really, check in with the school and be aware of what might the district offer, who are supportive individuals. And sometimes, depending on what's going on in a particular family, we might not always be in a space where our child is wanting or ready to talk to me as a parent. That both could be just because I'm the parent. It could be because there's a history of tension or conflict there. And so, okay, is there someone else that can kind of also help to be someone who is also available as we kind of continue to work on things that might help us? Another thing I wanted to kind of just note that, also comes to mind in regards to a lot of what we're talking about, and even in the midst of thinking about these other outside supports or people who can be individuals who might observe these changes, is that we have to recognize the potential disparities. And I think that's another thing that's kind of really come up in the midst of this timeline, where it's very salient, and we're thinking about aspects of social justice and just looking at kind of the data around how there are a lot of individuals who don't necessarily have those same supports, or who are going to be facing stressors that others aren't. And so we really have to kind of be attuned to these potential disparities and risk factors that might be going on within the individual child.
Excellent. I know as an association, the Y also is playing a prominent role. We recognize the needs of our youth, and a big thrust of our work is related to youth development. And I know in our particular branch, we're doing community-based projects where we have a teen outreach program where we're providing a safe place for teens to drop in and have community, have mentorship, but something that is consistent for them. And so the Y has and will continue to, and it's important, as you noted, for youth to know that there are other resources out there in the community, that coach, that teacher. So excellent. Dr. Bradshaw, before we close, anything else that you want to say or share that would be important, as well as particular resources that you might point us to?
Yeah, certainly. I think, again, going back to technology and the internet and thinking about the positives of it is it does allow us to maybe more easily look for supports. I know that it's not always easy for the family that are kind of trying to support their child, or might have those concerns, to just get connected right away. And so there are various means or methods of trying to find those supports. And so that could be things even just by having those community supports and services, thinking about connecting with the Y, or things like Boys and Girls Club, these after school programs, thinking about various online support groups. So NAMI has, some groups. So NAMI has some parent and family-based groups. They even have a children, youth, and family liaison as a resource. You can even look up on meetup.com for different kind of informal groups of parents who get together. And the challenge is there's not always a centralized resource, but if you can start to just do searches online, you might start to kind of find some current links in your area. Some of that is virtual, and that might make it easier to access. Some might be in person. People should look into whatever their insurance is. There's the crisis and access line as well. That is another important resource to kind of look at what's in the community. And, just asking the questions, right? Like if you go to your pediatrician or you go to another provider, just seeking out those referrals, finding out what you know, and looking into those things, looking things up online, because there are resources out there. Sharp itself, like I said, offers our outpatient programs as well. And so those are usually kind of geared more towards youth who maybe are needing a little more support than what they might be getting in weekly therapy, or oftentimes is something as a step down from being hospitalized. But we get individuals who kind of come through there. And so, there is a way to access that. We have a number. You can find us online as well, but we have partial hospital programs. We have programs for youth who have mental health and substance use concerns. We have programs basically from 6 to 12 for younger kids, and from teens 12, up to 18. So there are options out there. They're not always easy to kind of locate, and sometimes it does take time, but just making sure to kind of find time to just do some of those searches and ask around.
Wonderful. And I know that Sharp is very highly regarded, well respected for the mental health services and other, but we're speaking to the mental health services that are provided to the community. So Dr. Bradshaw, thank you so much for being with us today and sharing your expertise and in guiding us truly in this challenging time for youth and caregivers. So thank you very much.
Well, thank you for having this series and bringing awareness to this. Really appreciate your time, Jonathan.
Thank you. And to those with us, please be well until we gather again. So have a wonderful day. Thank you.